Good, how are you? Yeah. Yeah, I think you.
Good evening. I'll call the March 26th meeting of the Health and Human Services Committee to order. I'll ask if there's anybody from the public that wishes to address the committee first before we enter into our presentation. Going once, going twice. I'll ask if David Paulson could please do the introductory for our guests tonight.
Well, we've asked Joanne Sakala of the Sakala Law Firm to come here tonight, who's our resident expert at the moment on opioid litigation. She has represented Jefferson County in the past in what we call the AWP litigation. Stood for average wholesale price litigation about 10 years ago. Her law firm, and she was our principal contact, I think, at that time, and lead in that litigation, representing most of the other counties also in Jefferson County against most of the same big pharmaceutical makers who were essentially inflating the price of drugs that were being sold to Medicaid recipients in New York State. And in that case, across New York State, millions of dollars were recovered, and I think Jefferson County certainly recovered hundreds of thousands at the very least. Yes. I'll let her speak to a little bit on that, but she's now branched off, has her own law firm, and is representing counties in several different states in this opioid litigation. And with that introduction, I will let her give us a little primer on opioid litigation and how she would suggest we proceed, and then take some questions.
Thank you, David. Thank you all very much for the opportunity to visit with you this evening. As David said, my name is Joanne Sakala, and I'm now, I launched my own firm in October of 2017 after almost 20 years with the New York firm of Kirby McInerney. And while I was a partner at Kirby McInerney, as David mentioned, I had the honor of representing Jefferson County and 42 other New York counties and the city of New York. I was also deputized by New York State in connection with a large, complex commercial fraud case that involved Medicaid fraud and pricing fraud. And that's how I first came to work with Jefferson and New York municipalities. I want to give you a little bit of background about myself. I had the pleasure of meeting Mr. Maxton a couple minutes ago before the meeting, and as he shook my hand, he said, "You're the ambulance chaser." So I want to make I want to make contact with that right off the bat and tell you a little bit about myself, because I respect your perspective on attorneys and on plaintiff attorneys and on tort lawyers, which I haven't been, frankly, until this case, the opioid litigation. I joined, just by way of a little bit of background, my parents were born and raised in Brooklyn. I grew up in New Jersey. I got myself into Georgetown University, and I thought I was going to go into the Foreign Service. I graduated from their Foreign Service School. I was the first person in my family to go to college. It was a very big deal for me at the time. I found through my experience at Georgetown that I wasn't that interested in working at very high-level policy initiatives. I was much more interested in where rubber meets the road, much more interested in local government. And so I left Washington, D.C. after I graduated, after a year and a half of doing some really interesting work with the Agency for International Development. And I wanted to get down into local government activity where policy becomes practice. And I took a job working for the city of New York, and I kept that job throughout law school. I put myself to Fordham Law School at night, working for New York City government. And in my heart, I've always felt deeply committed to public service. Upon graduating law school, no surprise to many of you, I found myself with a substantial amount of debt, having undertaken this expensive education. And I went into work in private practice for a New York defense firm for a few years. That was quite unsatisfying. And I found my way to Kirby McInerney, which was a plaintiff securities class action and consumer litigation firm. He's the man I trust with. And I found that work quite stimulating, but what my heart remained in the public sector. And I convinced my partners at Kirby to let me endeavor to develop a municipal practice where we would serve public clients. And my partners at the time were quite intrigued by it, but it was something new for my firm. It was something that we embarked on wholeheartedly. And true enough, I was able to launch a very successful municipal practice at Kirby. I represented the city of New York in 4 different litigations, and then the counties in the Medicaid fraud cases I mentioned. I represented the state of Iowa, the state of Michigan, and other pharmaceutical cases. And what was so satisfying about that work for me at Kirby was that I was able to work in the private sector, but still feel like I was on the right side of the angel, and that I was going after corporate America when they engaged in fraudulent conduct, which happens from time to time. It doesn't happen every day, but it happens from time to time. I was able to, I had a platform where I could represent public clients who had been wronged by the private sector and return money to the taxpayer. That's what it really was about for me. I felt, and I still feel, and this is what the philosophy that guides my current practice, democracy is hard enough. Government is hard enough without fraud. What you all do here through your meetings, on top of your jobs, on top of your other commitments to your community, it takes a lot of energy and a lot of work. And so I find it personally offensive, and it gets me out of bed in the morning to go out and do what I can to help democracy function the way that it's supposed to help government function the way that it's supposed to. And in those average wholesale pricing cases, that was felt like a true calling for me back in those days. because we had evidence that big pharma, all of these prescription drug manufacturing companies were lying to the big pharma, taking advantage of Medicaid. That's the kind of case that gets me very excited. That's a blatant fraud on the back of taxpayers. We're going to take action, and we did. And our cases in New York were very successful, and they were novel. They were novel in that we went after brand manufacturers and generics, which no one else at the time was doing, and we won summary judgment in federal court that brought everyone to the settlement table. We proved that those companies were lying about their prices. So I'll fast forward a little bit through my own background to get you to bring us to where we are today. At the conclusion of the AWP cases at Kirby, I found myself personally in a very different place than I had been when I started. I had gotten married, had moved to Texas, I'd had a child, I became a stepmom to 4. My whole life had changed during the course of the AWP litigation. After those cases concluded, I took a short break. I thought I might be done with practicing law. Well, I kept myself busy during my short break. I got very involved in local politics and some other things in Texas, but I found I actually really missed this practice. And in the middle of 2017, a number of New York counties came knocking because they were considering getting involved in the opioid litigation. I wasn't practicing at that time. I hadn't launched my new firm. So I had to decline the representation. But my dialogue with them got me focused on the opioid litigation. And I started looking at the allegations, the cases that had been filed. I looked at the Purdue settlement from 2007. I looked at what the federal government had been doing in this arena, what the states were doing. And then I looked at what all these tort lawyers all across the country, the cases that they were filing against manufacturers, and some of them were filing against distributors. And what I saw was that they were missing key components of how the opioid epidemic occurred. They were blaming the prescription drug companies, Purdue in particular, but then also the generics who copied Purdue. And they were starting to go after the distributors, but they weren't focused on pharmacies, big chain pharmacies, and they weren't focused on pharmacy benefit managers. And as I considered the entire fraud in the epidemic, as each component of that distribution chain, each step in that chain, struck me as a necessary party to any opioid litigation. And so I began going out, and I launched my firm. I started talking to clients. I'm now representing Webb County, Texas, and 45 municipalities in Virginia. And we filed cases against each of the entities that I just mentioned. But when I've gone to talk to those counties, just like I'm here to talk to you tonight, we start by focusing on the origins of this epidemic. Because this opioid epidemic really is, and I'm familiar with the fact that you guys have been talking about this for a little bit. We've been considering what to do, so I don't intend to lecture about how widespread and damaging the epidemic is. But the reality is, it is a singular event in our country, and I say it's singular because the fact that that communities are now struggling to deal with the consequences of this widespread addiction is not accidental. This is not an accident. The plan to increase opioid utilization was hatched by Purdue Pharma back in the early 2000s. And I'm not speculating. The benefit of talking to you today, as opposed to 2 years ago, is now we've seen a lot of evidence because some discoveries already occurred. Purdue Pharma launched a plan to increase opioid utilization. That was their objective. And they spent millions upon millions of dollars to change the perspective of the medical community, including the federal government, with regard to the risks associated with opioids. And people have been using opioids for centuries, right? It's one of the oldest substances on earth that man has used for pain. Up until the late 1990s, people understood it was highly addictive. Purdue launched a deliberate campaign to change the medical community's mind with regard to the dangers of opioid use. And they did it to make money. And we have evidence, communications between the most senior leaders of Purdue, including members of the Sackler family, where they reveal repeatedly their objective to increase utilization, the fact that they don't care that they're creating addicts along the way. They're doing it to make money. And their efforts were successful, but they were successful only because they had the cooperation of other participants in the drug distribution chain. So you have drug manufacturers who hatched this plan, right? Purdue started it, but then these other defendants copied it. The other manufacturer defendants in these lawsuits are generic manufacturers. These are copycat companies, all right? These are not companies who are doing innovative treatments. These are companies who identify blockbuster drugs that they know will sell, and they make copies of them. And that's fine. There's nothing wrong with doing that. There's nothing illegal about making a copycat drug. But I do want you all to understand who the manufacturer defendants are. It's Purdue, who owned the brand, and then it's the copycat generic, who jumped on the bandwagon that Purdue launched. Next in the chain are the wholesalers and distributors, who have obligations under federal and state law to make certain reports when they see opioid-controlled substances moving in certain volumes. Those guys went to sleep at the switch. As opioids are moving in volumes that are inexplicable under any rational scenario, they turned a blind eye. Or, worse, they lobbied state and federal governments to increase their reporting thresholds so they wouldn't have to reveal that X number of pills were going into Y county. Next in the chain, you have pharmacists. Pharmacists also have similar obligations to distributors. They too, in varying measures, not all pharmacies are the same. And we have data that would allow us to show which were worse, which were, but pharmacies too have statutory and federal obligations, turned a blind eye. That's sort of the machine, getting the pill from the manufacturer to the patient. Then you have doctors that are involved sometimes too. You have doctors who were purposely writing scripts to people who didn't need them, doctors who were getting paid off by drug companies. You've got some rogue doctors, and then you've got pill makers, some bad actors and pill makers. That's the machine that moves the drug. And the grease in the machine that allows it to function is provided by the pharmacy benefit manager. They determine which drugs are reimbursed by insurance and which drugs are not. Whether you're talking about commercial insurance or private insurance. PBMs create formularies. Those are a list of drugs that are approved for reimbursement. The PBMs not only create formularies that list the drugs, they rank them. You can get this drug for a lower copay than that drug. This drug is covered, that one's not. So what the PBMs did is they gave preferential treatment to the most addictive drugs. And they kept less addictive alternatives off their formularies, so they wouldn't be as readily available for patients. So if you have a doctor who's going to prescribe something for pain for a patient, the doctor's going to prescribe, often will see what's covered. Your policy covers this, I'm going to prescribe that. Your policy doesn't cover acetaminophen, so I'm going to give you Oxycontin, as an example. Acetaminophen to this day is not covered by most of the PBMs. So those are the different defendant groups that you can talk about when we talk about the epidemic. Drug manufacturers, wholesalers, distributors, pharmacies, pharmacy benefit managers. Now, and also I'll put over here doctors and pillars. Now, thousands of municipalities around the country have filed lawsuits. States, counties, cities, and they look very different. Some are only suing drug manufacturers. Some sue drug manufacturers and wholesalers. Some sue the whole line, right down to some individual doctors and pill mills. Some include pharmacy benefit managers, some don't. There's a variety of ways, as with anything in life, there's many different ways that one can proceed with it, if one wants to. But with each county or city that has filed a suit, the bridges that they've crossed is they've decided, yes, we see there's an epidemic. Yes, we understand the roots of it are man-made, it's not accidental. We are aware that there's blame to be shared among many different actors, and some of that blame, if not all or most or majority, resides with these corporate actors. And so how are we going to respond? So I think that may be where Jefferson finds itself at this moment, is coming to understand there is this epidemic. It has impacted your community in a variety of ways. Obviously, it's impacted law enforcement, social services, education, first responders. There's many different ways to measure or to identify how the epidemic has impacted. question is, what do you enough to do already? You have enough work to do. Your county employees are already, I'm sure, quite busy in their day-to-day without the idea of taking on whatever work might be associated with litigation. So, and I can talk about the burden that would fall, the burden associated with filing a lawsuit. But it seems to me that the countervailing point is, to any burden, is what does one do as a public servant when you learn of this sort of bad corporate behavior? What is the consequence? Who holds those corporations accountable for the harm that they've done? And not just the harm that's already occurred, that's in the past, but going forward. How do you hold them accountable in the future to improve the situation here in Jefferson? How do you abate the crisis? How do you deal with prevention and treatment? How do you prevent this from continuing? How do you reduce the flow of opioids into your community? So it's sort of, when you're faced with those questions, how does this, given that the epidemic exists, given that we understand how it started, what do we do at this point? One option that you have, obviously, is litigation. Another option is to not litigate, right? Now, what are the consequences of not litigating? It's hard to say. It's hard to say what the consequences are, in all honesty, because there is activity taking place at the federal level and at the state level. So there may be corrections in the system down the road, but we don't know. So the benefit of participating in litigation is that you're putting pressure. You're putting pressure on the system to correct itself. And that is one of the most powerful things that litigation can do. And here's an example of how that corrective pressure can be applied through litigation. In our case that I filed on behalf of Webb County, Texas, we filed a motion back in September in federal court, because we filed in federal court to a part of the MDL in Ohio. We filed a motion asking our federal judge, Judge Polster, to direct the pharmacy benefit managers to change their formulas, to cease giving preferential treatment to opioids, to make sure they're covering all the drugs that are needed to treat opioid use disorder, and to make sure they're covering less addictive pain treatment, right? It's nothing to do with anyone wanting money. This is injunctive relief. It's saying change the system, right? Because Judge Polster said when January of 2018, when he began that MDL, he said his number one objective was to abate the flow of opioids going into the community. This injunction that we filed for Webb was very favorably received by the court, because he sees this as a tool to help correct the problem. And now the court is guiding us and the PBMs in a series of negotiations designed to reach that injunctive relief that we have asked for. That sort of activity is not possible without participation in litigation. So while you all are thinking about possibly filing suit to recover damages, I would suggest you also think about perhaps even more compelling reason to file suit is to hold these companies responsible prospectively, to make sure that going forward, the system operates in a way that doesn't cause as much harm to the county. Does anyone have any questions yet so far on anything that I'm talking about? No? Okay. Let me talk a little bit about, I can address so many different topics. Let me talk a bit about what the federal government's response to the epidemic and the state government's response to the epidemic. So this is something that came up prior to the meeting. As we know, the White House has made clear that addressing the opioid epidemic is a priority for the federal government, and has declared a national emergency related to the epidemic. And they've created a task force, and they are looking at ways to deal with prevention and abuse and treatment going forward. We are not seeing the federal government bringing lawsuits against the participants in this litigation. We have state AGs that have brought lawsuits, and then we have municipalities, counties and cities are carrying a lot of the water. I can only speculate as to why the federal government has not brought its own lawsuit, and I'm reluctant to do that. I do know, and I'll quote Judge Polster here, Judge Polster has said, the blame for this epidemic, there's a lot of blame to go around. And I know from my own experience in this litigation that there are ways in which the DEA may have done more. You all have probably seen some of the 60 Minutes episode that was on a few weeks ago. There's some criticism of the DEA's handling of the information that it had in its possession. We're just in the process of receiving all the data that the DEA has with regard to prescription opioids. So I don't have an opinion that I can share with you yet with regard to the DEA's culpability. But what I can say is that one thing the DEA never did was sanction intentional fraud and intentional mismarketing and intentional deliberate conspiracy to change the medical community's perspective on how addictive opioids are. The DEA never blessed delivery of thousands and thousands and thousands of pills to particular communities. You know, the DEA never blessed rogue doctors issuing prescriptions that they shouldn't. And they certainly didn't bless the notion that pharmacy benefit manager formularies should not cover less addictive alternatives to opioid medication. So even if there's some blame to be ascribed to the federal government or how it managed the Medicare program or how it managed the Medicaid program, that does not take the intentional corporate wrongdoers off any hook when you have such strong evidence of this conspiracy among them to push opioid legalization. And the evidence really is overwhelming, and it's frankly somewhat nauseating when you read some of the communications between these senior people within the defendant group. You have senior individuals at some of the generic manufacturers, not even Purdue, but some of the other generic manufacturers. You have senior officials within the companies talking to each other of their certainty of creating demand for their products because they know they're creating addicts. If we can move a certain volume of this product to 35-year-olds, one email exchange, we know that we will have addicts by the time they're 40. They're literally planning on spreading addictions based in a demand for the drug. So the fact that the epidemic has occurred, that the addiction is as widespread as it is not a surprise. It was an intended and no, even if you don't want to say, oh, no human being would wish addiction on another, they knew their products would lead to addiction. They knew that addiction would lead to more demand. They knew that that would drive utilization and drive profit. And that was their motivation. So it's in response to this sort of compelling evidence that we see municipalities taking action around the country. And my objective was you all to inclined to file a lawsuit and to hire my firm to represent you. My objective would be to address the particular concerns that you all have with regard to how this epidemic has impacted your community. How has it hurt Jefferson? What has it done to your labor force, to your police force, to your schools, to your social services? And what would you like to see going forward that would be different so that we could craft injunctive relief to address real concerns here in the community? I don't know if you all saw just today, it was announced that Purdue has settled with the state of Oklahoma for $270 million, which is not a surprise. They were scheduled to go to trial in about 2 months. So this wasn't a complete surprise that they reached a resolution this close to the trial. The majority of the settlement dollars, though, and the state is the entity that's settling, is going to be used for prevention and treatment facility in the state. That's the sort of creative resolution to this terrible epidemic that really, I think, is very interesting and compelling. Because, even if we can correct the wrongs, correct the marketing, correct the formularies through litigation and otherwise, you're still left with the consequences of this addiction if this is taking root, So even if the companies start behaving better tomorrow, you've still got cleanup to do because you've still got tens of thousands of people in your community who've been impacted by this. And I want to share something about, now that I talk about community impact. This was I pulled this together using some data from the CDC. The CDC is really interesting. So, instead of disease control, the 2013, in 2013, the CDC, or in 2013, very clearly, that opioids is not to prescribe cancer and end of life, EC came out and said in 2013. And yet, here we are, so many years later, and the CDC guidelines have still not been put into place. PBMs are still not constructing their formularies in a manner consistent with the CDC guidelines, so you still have opioids. Now, you still have opioids being prescribed in manners that are inconsistent with federal regulations. So that's an example of the federal government trying to inform folks of the right way for opioids to utilize, and still the epidemic persists. This chart intrigued me. This is data that we pulled from the CDC on the prescribing rate, and you see the blue line is Jefferson County. If we took this chart back, the CDC data that we have available to us ends in 2006, but if we took this chart back to 2001, all of these lines would be much lower than they are. Like the graph, right? We're picking this chart sort of begins mid-epidemic. And what we see is you see the top line is for the United States average, then we have New York, and then at the bottom we have Jefferson County. Jefferson's increasing for the most part from 2006 forward, but then we have this sharp jump in 2014, which is really quite something, almost doubled, and then it's maintained since then. And this jump is reflected, or the consequences of this jump are reflected in other data that I've looked at related to Jefferson. Seeing an uptick in emergency room admissions, treatment admissions, uptick in overdose, uptick in deaths due to synthetic opioids. It's sort of tracking this prescribing rate that you see on this chart. And what that tells us is there's a consequence. There's a consequence to the county of the increase in the opioids that are being prescribed here. And that's really what I think our conversation and your deliberation comes down to. More opioids are coming into this county. There are consequences to the county as a result of that. What do you want to do in response? What do you want to do about that? If you know that the corporate action at the root that unleashed this prescribing, do you want to hold those corporate actors responsible? That's up to you guys. But this really jumped out at me because I'll tell you this, and I don't know I don't know yet what's going on here, and I don't mean it to sound, I don't know something's occurring in the county that led to that jump. Most of the other, not most, every other entity that I represent, their numbers sort of track the state and national trends. Where you guys have this, this uptick. So that'll be very interesting to learn to understand exactly what's occurring here. I don't know if it's just a data collection issue, could be, but as I said, we don't just see an increase in prescribing rate, we see an increase in these other metrics that one might use to evaluate impact, such as emergency room visits and so forth. No questions?
I'll stop you short there for a second then, and I guess just to try to extrapolate a little bit more information out of this graph, because I did get to see it earlier today. Just how exactly do they come up with the figures on the numbers on the prescription here that's being doled out? Is that just strictly going to, average patient or client going to a pharmacy, picking it up there from the pharmacist, or is this also inclusive of clinical setting dosages?
It is.
Okay.
This is clinical. This is inclusive of hospital, clinical setting dosages as well.
What about treatment centers? Like, we have a Cradio. Correct. Yeah. They also use a particular drug that's listed here to assist with people in their treatment and recovery efforts.
Right.
So is that also inclusive in this, I presume, too? Or?
Yes, that is inclusive. That is inclusive of this as well.
Okay.
So, are you curious then that this might be a reflection of a new treatment facility?
I think there has been question amongst a couple of us in response to why the figure might jump. It just are you able to dig in deeper to have a better understanding of why that would have jumped like this? Because
Yes,
it
the
almost
short
seems, it doesn't, you know, as you say, it seems rather uncharacteristic of
It does.
what's happening.
It does, and I'm almost, you know, frankly, I went back and forth about whether to even raise it, because it could be a quirk in the data, and it could be a change in how the data is collected. But it is what the data reflects. Even if that blue line didn't jump, I'd still want to be talking to you all about how you're going to respond to this epidemic. Because the fact we're not here because the blue line has jumped. We're here because the rate is what it's been over the course of so many years, and it's causing the consequences that it's causing already. But certainly we can drill in and would want to understand if that's a reflection of a treatment program, which is certainly unoffensive, right? Now that may be representative of a cost and a burden that the county has had to take on, right? So it's something we would still be interested in knowing if the county has had to fund and build in place a treatment program, that still resources are effective through that, right? Or is this, you know, is this the fact, did a pill mill spring up somewhere? Is there a doctor who is prescribing, you know, off the charts? I don't know the answers to that yet, but this is the sort of thing that we routinely unpack. And would be part of what we would want to do. Now, I mentioned doctors a couple of times, and I want to pause on that for a minute. As I said earlier, these lawsuits, those folks who've elected to file litigation, the lawsuits look very different depending on the preferences of the clients and the environment in which they're operating. Okay, there's no one-size-fits-all way to do this. Okay, and so that. If that's a conversation that you all want to have about the different defendant groups and what would be advisable, we can drill in and talk defendant group by defendant group. But I wanted to just mention that at the outset, that I'm not going to stand here and say there's only one way to do this, and you must do it this way or not at all. That's not the case, because rarely in life is that the case with anything. Sometimes it is, but usually it's not. The actions of each defendant group is somewhat different, and I like talking about them together because it was a conspiracy among these different entities. They were all in communication with each other, sharing data, sharing information. They all are very sophisticated actors who hold themselves out as caring about public health and delivering quality, you know, health services. That's what they say they do. You know, drug companies, so much of what they do are what expands lifespans in this country, right? And keep us healthy and keep us all moving around. I'm not here to indict big pharma. I'm here to talk about their actions with regard to these particular drugs. Because their actions with regard to these particular drugs are really extraordinary and unusual in terms of the egregiousness of the plotting and the knowledge of the consequence, and the recklessness and the lack of care for how that consequence would harm our community, and the lasting effect of the consequence. That's, you know, some of the data that I was looking at for Jefferson that was most disturbing were the increases in overdoses and death rates and emergency room visits among the young people living here. Those rates have increased more quickly in Jefferson than for some of the older folks. The addiction among youth because of the opioid epidemic is one of the largest problems. You know, where you've got kids who had their wisdom teeth pulled and they're given 90 days of OxyContin. I mean, the science tells us that these drugs begin to alter brain chemistry in 3 to 5 days. In 3 to 5 days, they change the wiring of your brain. So you can have a perfectly healthy, wonderful kid who 7 days later, her brain isn't working the way it used to. And it's not her fault. It's not her fault. And that's what's at the heart of this, you know, and these companies were aware of that. And yet, they didn't change their behavior. They didn't add warnings. They didn't inform doctors, you know, we're using this for a kid, they pushed. Their scheme worked. They pushed the drugs. And now, it's cleanup time.
With that, I think there's some council members that are ready for some questions to field you. I think Mr. Gray had his hand up previously. Do you still? Well, you did a while ago, I thought, but yes or no? Okay,
And
Mr. Ferris. Mr. Ferris has a.
And I apologize I didn't give you any of the handouts.
Are you yielding the floor?
Okay, so there is a good possibility then that there is something else going on if Kratos didn't start till 17. Okay. Mr. Ferris, please indulge us with your question.
With my wisdom?
I said questions first.
Yes. I'll wait for her to get back up. I'm not whipping the chains, and you'll be fine. You put pharmacies into this, and the pharmacies are filling prescriptions. They're not giving out drugs to people who come in with pain. However, we have a bunch of really good local pharmacies, and I refuse to believe that they were part of the big epidemic. So and we have a lot of good doctors too, and the doctors get their information from the pharmaceutical people that come in and explain to them how to use the dosage and explain to them what is there. So I'm having a hard time believing that the doctors in our community, and that's where I'm coming from, our community, are purposely trying to do this. So if they've been given the wrong information and prescribing things incorrectly, and the pharmacists go to meetings as well to learn about the drugs so they can catch things that are being interacted, and the pharmaceutical companies put those on as well.
That's right.
You know, so my issue that I have is when you state the doctors and the pharmacies, I think you said some of the bigger pharmacies maybe, and I don't know where you got that information, had sent letters back and forth saying, okay, we'll do this, or however. I think about our local pharmacies in our state and the local pharmacies in our county, and I would think that the doctors that we have and the pharmacies that we have will not take part of that. If their misinformation came, to me that would be from the pharmaceutical companies.
You're like victims. You're like a victim.
They're an equal victim.
Yep, I agree with you.
So that is an issue that I have with the suit. And I know you said you can go back and forth and pick who you want to sue or how you want to do it. I'm making that a little bit more simpler than what you said.
Oh, no, it's fine. It's fine.
Okay. But I would have a problem. I mean, why is this a big thing with pharmaceutical companies or drugstore chains that are...
So, first, none of the clients that I represent have named a mom-and-pop pharmacy or a doctor. None. Every one of them feels very strongly about the doctors in their communities and their local pharmacies. The pharmacies, the mom-and-pops are just filling scripts. They're making the reports they have to the state prescription drug program. They're not involved. They were just doing their job. And the same for local doctors. We're the only place where some municipalities and governmental entities have named doctors when they've identified specific acts by a particular doctor that rise to the level, frankly, yes, that's right. And I think there've been a few doctors here in Jefferson who've gotten in trouble over the last decade for improper script writing. I think those doctors have been dealt with from everything I've read. So I don't know. The way I approach all of this is I let the data direct who are the appropriate defendants. Let the evidence direct who are the appropriate defendants. I don't subscribe to the notion that you should just be naming doctors and naming every pharmacy. There's got to be something more there to demonstrate knowing complicity. Some of the big chain pharmacies, some of the large ones, when we look at the data that we have available about the volume of drugs and how they were moving, there is no way these pharmacies were abiding their state and federal regulations for reporting. They were simply shipping products. Do I have data like that for particular pharmacies here in Jefferson County as I stand here talking to you? I do not.
do you have the names of any of these big pharmacies that are that big?
Well, the other, by way of example, so the other New York counties who have already filed suits have recently added Rite Aid, CVS, Walgreens, and Walmart to their cases. And Walgreens has had some trouble, Walgreens in particular, has had some trouble with controlled substance reporting, and the federal government has fined them numerous times, and CVS has had a little trouble too. But I would, right. Right, that's right. Personally, the pharmacies are the least appealing defendant group for me, which is not to say they're not complicit. There's complicity where they have knowledge that they're moving large volumes that cannot be medically appropriate or medically necessary. Right. But if we were to be engaged on behalf of Jefferson, we would look very closely at the particular data for pharmacies within Jefferson, and that could be a conversation. What are we going to do with the data that we see? And how do we explain the data that we see with regard to particular pharmacies here? Because, I know, I've talked to a lot of doctors who are very upset about this. Doctors who are in their 50s and 60s and early 70s who remember vividly, their early years of practice and their approach to using opioid medication and how that changed because they were bombarded with information from seemingly neutral third parties and drug companies, and they accepted what they heard because they believed it was being presented to them in good faith. And those doctors are angry. Those doctors are angry, Sure, you're going to have a rogue doctor here and there, but in the main, they're doctors, right? They're trying to help us. They're trying to help us stay healthy. So, they rely on information they get from drug companies. They have to. They should be able to, right? There's a breach of trust here. Now, who breached that trust? The manufacturers.
You'll be correct in saying that there was a doctor in particular a number of years ago that was engaged, and yes, he was dealt with.
Yeah,
so, Mr. Maxon is next up with some questions for you.
Thank you, Mr. Peck. How do you prefer Joanne?
Sure, Joanne.
No,
Joanne.
I just wanted to say I find it refreshing that you would be willing to represent the county pro bono. I think that's a phenomenal thing to do that sort of work.
No, I'm not willing to represent pro bono.
Oh, you're not?
I'd be willing to represent on a contingency.
Oh, see, I heard you say that you love being on the right side of the angels, that returning money to the taxpayers is why you get out of bed in the morning, and that helping taxpayers recoup costs is your favorite part of the job. So I just assumed that you were working in the public interest.
No, well, I am, but I can't work for free.
Oh, okay. When you represented the county and brought us back tens of thousands or hundreds of thousands of dollars in Medicaid settlement, what was your contingency cost? How much did we pay you for that?
15%.
15%.
15% of the recovery.
Okay. And just based on the litigation that's gone forward and the settlements that you've seen, what do you think our potential settlement would be as Jefferson County?
I don't know yet.
Is it in the tens of thousands or is it in the millions?
I would hope that it would be in the millions, given the extent of the impact on the county, but I don't know. We haven't drilled in on your particular county's expenses yet. I've taken a general look at your budget. There are many different ways to measure damages here. Everyone who's involved in this litigation is grappling with what the appropriate measures of damages are.
I see working on contingency, 15%, why you would be so eager to name so many defendants, to sweeten the pot, to personally profit from the pain of these people who are victims of this opioid crisis.
Well, the only way that I would profit from any of my activity is if the defendants were culpable, right? It certainly would be a very poor business model of mine to undertake the sort of effort that my firm is undertaking with regard to defense and the other hours of our time into these matters because we believe in the fight. So where I come from, when you believe in something, you fight for it. It doesn't, the fact that I have to make a living and feed my kids, just like you, and probably everybody in this room, and everyone in this community, it certainly shouldn't be controversial. And if there's an alternative measure of payment that you think is appropriate, I'd be very interested to hear it. But when it comes to practicing law, I think the contingent method with a reasonable contingency fee is by far the fairest, because it requires attorneys like me to be very careful about what we undertake. Because if we're incorrect on the merits, not only do we have the disappointment of not being able to deliver back to y'all what we thought to deliver, but we've also lost all of that time and effort.
One of the things that you said was interesting, that unless you believed that the defendants were culpable, there would be no payment to the county and therefore no 15%.
Unless I could prove it.
Right.
I could prove it.
We're involved as a municipal entity in plenty of lawsuits that are arguably nuisance lawsuits, much like this. And we engage in political or financial calculus with our attorney where he says we would win if we litigate this, but it's going to cost us more than it would cost us to settle. Now, if we convince, since this case is being tried primarily in the court of public opinion and being sued by so many municipalities, it seems to me that they don't need to be culpable. They just need to be able to do math and say it's going to cost us this much to litigate, and you said litigation is unappealing, or it will cost them a much lower number to settle. I don't know that you have proved to us that these people have broken the law. You said that the worst thing the distribution companies and the wholesalers did was to lobby the state to increase thresholds. Now, if prescriptions are increasing because of doctors or because the federal government changed pain guidelines, it would be, I assume, it would become a nuisance to the distributor to have to file more and more reports. It makes sense to me that they would want to lobby the government to say, your number is too low, we're moving so much more product. It would be easier for us if we could say 1 million pills or whatever the numbers are. I don't see in the wholesalers or the distributors, I don't see in the pharmacists, and I certainly don't see in the pharmacy benefit managers how they have broken laws. If they have broken the law, why hasn't the New York State Attorney General sued on our behalf?
I can't speak for why the New York State Attorney General hasn't sued on your behalf. If he were suing on your behalf, then perhaps you wouldn't be contemplating litigation of your own. But they haven't. So then it seems to me the question is, how do you, as a public servant, want to address the consequences of this epidemic in your community? One response is I'm going to abdicate my undertakings as a public servant and wait for the AG to do it. Another is for you to say, no, I'm going to stand up and I'm going to hold corporations who injure my community and my constituents. I chose to run for office to represent my community. And when I see my community harmed by corporate actors, I'm going to respond to that. So it seems to me, something that any elected official might, a dialogue that the elected official might have with himself or herself. Is how are you going to respond when you see improper corporate conduct? Now, it sounds like you don't accept the impropriety of the corporate conduct as to the distributors and the pharmacies and the pharmacy benefit managers. Based on what I've said here briefly tonight, I would welcome the opportunity to share with you the lengthy allegations that I've detailed in the pleadings I filed with regard to the distributor misconduct and their violation of the Federal and State Controlled Substances Act, and the pharmacists, the big chains. Only a few of them have engaged in behavior that rise to the level that I think it's appropriate that they be named. And as pharmacy benefit managers, no drug is reimbursed, is paid for, unless the pharmacy benefit manager has approved that reimbursement. They are the gatekeepers to every single opioid that prescription that is filled. So if pharmacy benefit managers are not following CDC guidance that they themselves acknowledge should be followed, who's going to hold them accountable for that? If you are...
Well, our pharmacy benefit manager is ProAct. I had a lovely conversation with someone from ProAct to warn them that we've hired a lawyer who brags about suing pharmacy benefit managers, just to give them a heads up, since they have a contractual obligation with us.
Well, Mr. Maxon, with all due respect, query if that's in the interest of your county to have had that conversation. In particular, because I'm not here talking about contract-based claims against your current pharmacy benefit manager. I'm talking about a very different type of claim that attaches to the county damages, not contractual damages. It's a tort claim.
What I mean to say is that we have a pharmacy benefit manager who has a formulary, who has negotiated pricing, and who is the gatekeeper for opioids. I heard you wonder why they gave preferential treatment to the most addictive drugs but didn't cover acetaminophen, which is an over-the-counter drug. I don't know why they would reimburse for acetaminophen when it is
because there's
over-the-counter.
prescription, I'm talking about 600 or 900 milligrams,
Sure.
prescription level acetaminophen, just as there's prescription level ibuprofen that would appear on a formulary. Why don't we drill in a bit into the actual claims against the pharmacy benefit manager? There are 3 pharmacy benefit managers that control 90% of prescriptions that are filled in this country. 3. Yes, only 3 companies. All right, Express Scripts, Caremark, and Optum control the control pharmacy reimbursement for over 90% of Americans. It's an enormous amount of market power. So every single opioid that is used through a commercial or private or public plan has appeared on one of the formularies that those 3 companies have created. And those formularies, to this day, are not compliant with CDC guidance. To this day, Express Scripts permit people to receive more than 200 MMEs daily of morphine, which is far beyond the 90 milligrams that CDC recommends. These 3 entities have an enormous monopoly on the control of reimbursement in this country. They are the grease in the machine that allowed this opioid epidemic to take root. And without the pharmacy benefit managers' participation, none of the produced products would have entered the marketplace through an ordinary course of insurance. So that is why pharmacy benefit managers are integral participants in this in the opioid scheme. Now I can drill in more. It's difficult to know at what level how deep you want to go. But when we talk about the claims against the pharmacy benefit managers, just like the drug manufacturers and the wholesalers, sound in nuisance, conspiracy, and negligence. Those are the types of claims that we're talking about. And these are companies that hold themselves out as putting patients first, putting safety first, when they are hired for the specific purpose of helping public and private payors control their drug costs and assure the wellness of their employees, and current employees and retirees. That's what PBMs do. But these 3 PBMs, working with the drug manufacturers, helped the explosion of opioid utilization. If the PBMs had installed ordinary controls on these formularies, the drugs would simply not have been available for reimbursement in the way that they have been. So, for example, in our injunction, we asked Judge Polster to issue an order that part of the injunction is that the formulary limits prescriptions for use, the scenario we talked about earlier, like the wisdom tooth child, can only get 3 days worth of opioids after the surgery, unless the doctor, there's always room for the doctor to exercise his or her discretion, unless the doctor says, no, this particular child needs a longer script. But the default for use should be 3 days, not 90. That's just an example of the PBM, of the ways in which the PBM can change their practice to improve the situation, to abate the flow of opioids into the community.
Mr. Ferris?
The term pharmacy benefit manager kind of leads you to believe that, we'll say Walgreens, local area or district has their own person, but we're actually talking not even insurance companies. We're talking insurance companies hire somebody else to tell them what they should do and what they shouldn't do for reimbursing people for their medicine?
Yes.
That's the question.
Yes, yes, but each of the three PBMs have relationships with insurance companies. But so Express Scripts until recently was the only totally freestanding PBM. But to get to the essence of what you're talking about, yeah, PBMs play a very discrete role. They just manage the pharmacy benefit. They don't, not the entire insurance package for an individual. So Blue Cross Blue Shield, for example, might work with any number of the different PBMs. United Healthcare uses Optum. Optum is a captive PBM that's part of the United Healthcare system. Caremark is part of CVS Health. So the PBMs are sort of freestanding in terms of their function, but there's some corporate tentacles that now connect them to insurance companies or other entities in the healthcare marketplace. But their role as a PBM is quite discrete, and it's the creation of these formularies and the installation of quantity limits, refill limits, prior authorization requirements, different hoops that a doctor would have to go through in order for a patient to have a legitimate opioid prescription. So yeah, their role as gatekeepers is actually very interesting. And I am proud to have identified their participation in this scheme because they've made millions of dollars off the movement of highly dangerous drugs that they knew were dangerous, and they stood in front of their clients and promised them that they were going to take care of their workers and their families and their retirees, and they didn't. And that's what they were hired to do. So I think holding them accountable for what they promised is appropriate. It's only that. It's holding them to their own statements. I would love to share with you the injunction papers and some of the details of what these corporations have said to the public about what they do and how that varies from the reality of what they do. To this day, they claim that they are compliant with all federal and state regulations governing opioids, and they're not. They're not, and we have demonstrated that, and will continue to demonstrate that to the
Mr. Jarrell?
Thank you, Mr. Chairman. To piggyback right on that, I have several questions, but that PBM is sticking right there right now. What's the incentive of this? How are they making money on over-prescribing opioids?
PBMs?
Yes, PBMs.
They're paid by drugs. They're paid in different ways. First, they're paid by their clients who hire them, just like you all have a PBM that you hire. So they're paid in the ordinary course by their clients. Well, where they really make their money is they're paid by drug companies. PBMs, because drug companies have recognized that PBMs are gatekeepers to utilization. Forget opioids. It's with any drug. If a drug manufacturer's brand new, whatever drug X has received approval from the federal government and can be launched and marketed, if that drug doesn't appear on a PBM formulary, then that drug's not going to get reimbursed, and they're not going to be able to get anyone to prescribe it or use it. So drug companies have recognized that PBMs play this important role as gatekeepers to utilization. So they incentivize the PBMs to construct their formularies in a way that maximizes the utilization for the drug company. And they pay rebates per pill. They pay service fees where they provide volume rewards if the PBM hits certain targets on a quarterly basis. If they move 500,000 units of X, they'll get a service fee of some amount. Or that if they achieve this, whatever threshold the drug company and the PBM might agree upon, if the PBM meets that threshold, the drug company will pay them additional money. If drug company prices fluctuate, the drug companies have to make the PBM whole to preserve the PBM's profit. The PBMs have such negotiating power vis-a-vis the drug companies that they have profit guarantees built into their contracts with drug manufacturers, so that they can, it's like an insurance that they build in for themselves. So that's how they make their money. That's how they make their big money. And this is not speculative. This is disclosed in their public filings. This is how PBMs make them. And this is the subject of tremendous scrutiny right now in Washington, D.C. The PBM's heyday is going to be coming to an end. They emerged as critical players in the healthcare marketplace in the wake of the Medicare Modernization Act of 2003, when all of a sudden Medicare was covering a much larger array of drugs than it had historically. And the federal government recognized that they needed someone to facilitate, to manage these drug lists of what was covered and what wasn't covered. The PBMs rose and filled that role. They originally were just claims processors, and they were brilliant at it. Gigantic databases, very tremendous cutting-edge technology. They were able to process claims quickly, which is essential to the functioning of Medicare, Medicaid, or any commercial insurance plan. You need claims processing capacity. That's where they started, but they expanded after the MMA of 2003 because they developed this power to control all drug utilization. And the drug companies recognized that. They saw that. And so since 2003 to this day, the PBMs have operated sort of as this undercurrent in the prescription drug marketplace. And they don't get a lot of attention because they're a little bit hard to understand what they do. You know, it's much easier to talk about a drug company or a wholesaler or a pharmacy or a doctor. PBM's the guy behind the curtain that allows it all to function. So those curtains are being pulled back now. But anyway, they play a critical role in the opioid litigation because absent their complicity, had they installed controls in their formularies, you know, back in 2007, we may not be talking about any of that.
So, in your litigation that's currently going on right now, is there any push to stop the pharmaceutical companies from paying the pharmacy benefit managers? This doesn't seem like there should be any flow of money in that direction to the. It seems like the health insurance companies should be solely paying for the PBMs, and there shouldn't be any money from the pharmaceutical companies to go in that direction.
Well, there's what you just described. There's a federal and statewide push. States throughout the country and the federal government are pushing to eliminate those secretive payments between PBMs and drug companies right now. In the litigation, we seek injunctive relief in terms of correction of the PBM formulary and their controls on opioids. And we request disclosure of what payments that they're receiving, what's motivating them to construct formularies as they are. And in the course of discovery in the litigation, we would be able to see in detail the payments that I'm describing to you. I came to understand what the role PBMs play in the marketplace back in the early 2000s when I was working on the AWP litigation. Because the focus of that litigation was to identify what true prices, what the actual prices were that entities were paying and being charged for drugs. So it was in the context of trying to get at accurate pricing that I discovered the existence of these three enormous companies that were skimming profit money off of every drug transaction that takes place. So much of what they skim is predictable and knowable, so the argument could be made that should be accounted for if you're going to determine what an accurate price is. And that's where those guys first hit my radar. But they're remarkable entities, and they on the subject of boasting, they boast now of how we used to be just claims processors. Now we are complex care providers, right? So where were they while this epidemic was exploding? Where have they been when the CDC says adjust the guidelines, this is what appropriate? Where are these complex care providers now, right?
So, earlier you talked about the evidence is going to direct the litigation, and so going forward with this, because I think to some degree, I can't quote the resolution that was passed, but to some degree, we've already made a decision to go forward in some manner or another. Going forward, typically, how would this go, and what kind of evidence would you bring to us, and who makes those decisions as we go along, and how often are those changes in direction talked about at our level? So I think that's important to us.
That's probably a question more for me. You know, certainly when we get to the point of filing, you know, we can make the board aware of who the proposed defendants will be, and you know, give an opportunity for feedback at that point. Not every day we take on a case like this, and it's probably appropriate that we have some feedback at that point. I'm not sure, that's something I need to discuss with Ms. Akela, you know, as far as what time frames are and how much time we can allow for such a thing, but I guess that would be my thought.
Okay. And one more question. Well, two more actually. Going back to your graph here, do you have any idea why there's such a difference between the national average and the New York State average, that those stay fairly consistent throughout the timeline?
No. The short answer is I don't. But I can get an answer for that.
Yeah, you've done some litigation in New York State already, correct, or not?
I'm not doing any opioid litigation in New York City. But I can unpack those two lines and give you a report back.
No, that'd be excellent.
On why on the difference.
Cool. And while you're relaying information, that goes to the next question.
Sure.
You talked about communications. You said they're nauseating between the pharmaceutical companies. I think they were I don't know exactly what those communications looked like, who they were from, for,
right.
back and forth with. Is that something we can see direct evidence of too, that you already uncovered?
I'm not. The protective orders in my current cases don't allow me to share the actual evidence. I'm describing it to you, but I can't show you the actual document. I think you're not litigants.
If we became litigants,
yes,
then we could.
Absolutely. Yes, if you become litigants, and the litigation, there's cases proceeding in federal court. There are New York counties in federal court, and then there's also the majority of New York counties are proceeding in a consolidated case that's in state court. And the good news is that the judges hearing the claims in both venues are very favorably, have responded very favorably to the claims. And those cases are being advanced and developed, and discovery is occurring there. So if Jefferson were to file, Jefferson would fall in lockstep, whether it was in federal court or state court. It could fall in lockstep with those cases. There would be a later filer, and there might be consequences to that down the road when talking if these cases should settle, or even if you're talking post-jury verdict and you're apportioning damages. But in terms of, you would be joining active litigation, and whether federal or state, you would be in front of a jurist who is favorably disposed towards the type of claims being alleged. The one distinction I will say is no other county in New York State at this point has named pharmacy benefit managers as a defendant group. That's something that we've done in Virginia and in Texas. And if Jefferson were to name PBMs, it would be the first to do that. That would provide Jefferson additional leverage in its litigation. I would recommend that you include PBMs, but that's a conversation that can be had. As I said earlier, there are many different ways to structure this, and one has to do what's best for the county and for those involved.
So, to piggyback on that,
yep.
though, with seeing the evidence, you said if we become litigants, and is that actually filing at that point in time,
yes.
or can we see it before we file? I mean, if we have to make the decision as to what we're going to file, I'd like to really see the evidence before we actually file it.
I feel confident without having to share review some of the emails that I'm describing, which I cannot share with you until you actually file the suit. I feel confident that the allegations that the information that's publicly available by itself would be sufficiently compelling that you would elect to file suit.
Why don't we start there?
Yes.
To piggyback on a couple of things that Legislator Jarrow just said, well, now that we have Oklahoma is done and settled, is there going to be information coming out of that might be able to answer some of his questions then, as far as some of the documented evidence? Or is that going to be kept sealed?
I don't know if...
Or is it too early to say?
Right. I don't know. Let's see. So what I'm hearing, though, is that you all don't feel that you would like additional information on the actual wrongdoing of the different entities that we're talking about. You'd like greater particularity as to the wrongdoing of the drug manufacturers, the wholesalers, any pharmacies, and any PBMs. I think that can be resolved one way to resolve that is sharing with you an example of the complaint that we have filed, where we allege in detail the conduct of all the drug manufacturers, each one of them, their conduct internally, how they funded doctors to go out as key opinion leaders to go out into the communities and alter the medical community's perspective on opioids, the funding of seemingly neutral third-party organizations, details of that nature.
Well, in a complaint, you said. Are there answers to those complaints yet? A complaint is an accusation, right?
That's correct.
With no evidence associated with it. I mean, if I could see the evidence along with it, but that's what I asked for before, and you said we couldn't see until we actually litigated. The complaint by itself, no, that doesn't answer my questions, because that's an accusation
the allegations,
without evidence.
So this may be you may be caught up in just some of the nomenclature here. So in the course of discovery, we collect evidence from the defendants, right? That and everything we're collecting from the defendants in our litigation is protected by court. We have protective orders that have been imposed by the court, and so that material is not available for the general public at this stage. And the defendants insist on that, and that's the environment in which we litigate. And there's nothing unusual about that. It's very, very typical that there are protective orders in place, especially in cases where some of this information is highly sensitive and proprietary information of these companies. That's the evidence. Apart from that, you have, to file a lawsuit, you need to have a good faith basis for every single statement that you make in your complaint. So what we do, and this is an extraordinary amount of work, but this is what we do. This is why we get paid. Is we collect from every publicly available source that we can information that provides a basis to make a good faith allegation. Because we're not going to file frivolous lawsuits. That's not the kind of attorneys that we are. It's not the kind of practice I operate. Okay? So every statement that's in our complaint is based on our due diligence and our research as to the accuracy of that allegation. Otherwise, this whole exercise would be ridiculous. We're just making things up and hoping they stick and hoping someone pays it. That's not how I live or how I practice. And Mr. Paulson has the benefit of seeing me and knowing me for 15 years. So it's frankly offensive to even suggest that that's how my firm would operate.
Well, I'm certainly not trying to offend you.
No, but as I ponder the statements, they really are quite extraordinary. This undertaking on our part reflects substantial research into the practices of each of these corporate actors that allows us to make good faith allegations with regard to their conduct that has led to this evidence.
And I understand it. And like I said, I'm not trying to question your integrity by any stretch of the imagination.
I know that you're not, Mr. Joy. I appreciate that.
But, I mean, you very well are likely to see the world differently than I am. Most people do. So that's why I would like to see, that go deeper down the rabbit hole, and actually see the physical evidence of what it is, and that's why I would like that, rather than the actual, just the complaint. You know, that it'd really be important for me to see that, and to do that after litigation is.
Well, so for example, our complaint cites hundreds upon hundreds of pieces of data and material. That's what we rely upon. So we can supply all that because we have all of that.
Yeah, and that's what I said. I'd like to start there.
And then we can also share with you the papers that we filed seeking the injunctive relief from the pharmacy benefit manager. Those are not confidential. They rest entirely on public documents that the pharmacy benefit managers themselves prepared, and their public filings with the SEC and their annual reports. So all of that material is publicly available. I can send you my declaration in support of the injunction, which has hundreds of pages of detailed exhibits that show you. And again, the beauty of that injunction was all of the documents. I can't call it evidence because these are just publicly available documents. They haven't come in through deposition testimony. They haven't been authenticated. But these are all public documents that the PBMs themselves prepared. And we were able to prepare a motion asking the court to issue this injunctive relief based only on their own material. And when you read it, it's quite persuasive and compelling. Because what you will see is the PBM saying, hire us to provide for the health and welfare of your employees and your retirees and all of your people, whoever they may be, because any corporation will hire a PBM, right? Pepsi, any large company hires a PBM. Then you'll see the PBM saying, we're complying with CDC guidance when it comes to opioids. And then you will see we have dissected their formularies and we have demonstrated they're not complying. It's just simply not doing what they said they would do. And we've put this all in front of our judge, and he is persuaded by it, as he should be. Because if you want, the paramount objective here is to deal with this crisis, to stop this epidemic, right? And then to heal from it, and to heal the community. Abating the flow of opioids in the first instance would be a major success, would be a major step forward. And so hopefully we're able to take that step through this injunction. So I hope that.
Yeah, I'd like to see that.
Absolutely.
Mr. McBride.
Oh, thank you. I just had a quick question. With this being a national epidemic and everything, why has the FDA not stopped or banned the sale of these most addictive opioids?
Well, because they do have a use. They do have good use. Not every opioid is bad opioid. Opioids used properly are not the problem. The problem is opioids used improperly.
Right. I just think I saw in the news how the president just passed a thing banning the manufacture of bump stocks, which took a product that made it worse. And when you mentioned there's been opioids around for years, some do the job, but the Purdue Pharma ones are just more addictive. Why can't they stop the worst ones?
Well,
contain the original?
It's not that Purdue Pharma is still making some of the most addictive opioids, but there are places where those drugs can be used and used properly. And the idea is not to no one is suggesting that the goal here is to get rid of opioids, or there never should have been an opioid use, or the FDA never should have approved opioids. The problem is that opioids have been used for purposes that are not healthy. So, and the CDC has cleaned this up when they issued their revised guidance. They've made it clear. Opioids for acute pain, post-surgery acute pain, that's fine. Opioids for end-of-life, palliative care, active cancer care, okay, that's fine. But opioids for chronic migraine, opioids for chronic back, opioids for wisdom teeth, no. In those scenarios, you use it. In fact, the CDC has explained that there is no evidence that opioids are effective for long-term chronic pain. Speaking of evidence, which is it's remarkable. And that's not just the CDC. This has now been repeated by American Pain Association, by national organizations that are focused on pain management. There is now an acknowledgement that there has never been evidence that opioids were effective for the treatment of long-term pain. Purdue convinced the medical community that they were effective, and they weren't going to use it. That was simply false. So the goal here is not to get opioids off the market entirely. The goal is to put them back in the box that they should be, and not to have them as readily available as they have been since the early 2000s, when the campaign really took root.
Mr. Reed.
Thank you, Mr. Chairman. So I thought I was listening, but the jump from Jefferson County from 2014 to 2015 on the prescribing rate, we don't know what caused that.
No.
We don't know what drove that. Is that possible that we can find that out? Because this makes it's extraordinary. Have you seen it double anywhere else? So I'd like to know what's driving that.
Yeah, I would too.
Because when you set that out in front of us, I mean, that
No, well,
is that number valid? Is it true? Is it, because we're basing our decisions on a lot of, there's a lot of attention to this graph.
yes.
And in business or something, you see a jump like that, it triggers a whole bunch of other conversations. So
Yeah,
I would like to see further information what's driving that, if we can back that up.
Yeah, well,
Thanks.
we pulled this data directly from the CDC. What we will do is endeavor to determine what were their collections. Because let me.
Was it underreported before?
Right.
And then there was a correction?
I don't,
So could this be even worse than what you're showing here, or
well, the data is
not
as
as
good as
bad?
the data is, right? Like with any data set. I mean, this is what we have from the CDC. So I don't know what occurred in 2014 to make this change. It could be that there was a change in how they were collecting data from this county, or how you guys were collecting data, or it could have been that there was some event within the county. It could be a legitimate reflection.
Yep. It would just be interesting to know.
I agree with that.
So,
I agree with that.
The other thing is the process. If we break this down to process, David, what is our parameters that they're being given? Now we wouldn't be at 30,000 feet. We'll be at ground level. But what are the process parameters? Is it going after everything? Or is it going after segments? Or what's the discovery process that they would do, or that you would have them do?
That's the next discussion Joanne and I will have to have is, what does she need to start formulating a decision on what to file and where to file.
Right.
Those are the two legal decisions, meaning
Right. Which
who the
defendants,
defendants are
which defendant
and
group,
which court do we,
which venue.
which venue,
Which venue.
state or federal,
That's
most
correct.
advantageous.
Yep.
And I guess the second question too is, what background do you need from county officials or county government, in terms of discovery prior to filing?
No. Yeah. I mean, one of the things that. Right. So.
Okay.
And we can certainly talk about that.
Some feedback at a given time. I've been around those things before too, and it doesn't always
That's
make
very
for the
fair.
best decision making.
So, and some of this maybe you all could, it would be helpful for me to understand better where the specific ways in which the county has been impacted, which we've already begun to do in anticipation of this particular meeting. I can tell you that the majority of the allegations, whichever defendant groups are included, the majority team would endeavor to do all that it could from publicly available sources because we want to minimize the burden on any of your county employees. And there is a rather robust public record as to Jefferson with regard to its efforts in the areas of public health and even dealing with the opioid crisis, and through the Alliance for Better Communities and the work that we see Ms. Hall doing with community health. So we would go through a process where we would interact only as needed with a few key county employees to get information on particular subjects relative to the suit. It would be as uninvasive as possible. I realize there's the burden. And that would be done in anticipation of litigation. And then, so we would talk to people related to treatment, prevention, law enforcement. We would drill in more on the CDC data and what we call the ARCOS data, which is data that we can access from the DEA that shows shipments of opioids into the county. And so that would be part of our due diligence in working with the suit. And we would move with dispatch with all of that. I mean, I've been through this drill quite a few times now with other counties, so I think we could move rather quickly to identify what we need from Jefferson in particular. The question of defendant groups and venue, I don't know if that's something we drill into here and now. We certainly can. Okay.
Yeah, I think the Mr. Chairman wants to weigh in on that, I believe.
That's correct. Step three here is meant to reflect a process where we would see if are there any state or local regulations that touch on any aspect of this lawsuit that we should have in mind. That's what step three here is. The different clients have wanted different impact evaluations in anticipation of filing these cases. So some clients have wanted cost impact reports, which we have provided, where we detail department by department. This is how we think from what the numbers that we see. Here are our approximations of how this has impacted your different budget line items within your county. That is something that we can do here. Frankly, we started looking at your county expenditures in criminal justice in other areas just to see what the trends were over the last few years and if there's been a lot of fluctuation. I have no problem doing that sort of analysis for Jefferson if that's something that you want. I will tell you that we don't need that level of granularity to put the pleading together. That's not required for the allegations we're making. We don't need to itemize our specific damages, department by department, personnel by personnel at this stage. It's very premature for that sort of analysis. I also want to share that there are very interesting and varied opinions as to how do you measure the damage that counties have suffered as a result of this. And those opinions range from looking at budget line items to doing a more macro evaluations that just look at overall flow of opioids into communities and overall trends in foster care, education, criminal justice, and doing more of a regression analysis on a macro scale. There are studies out there that have looked at the impact overall on the economy and how this is affecting our communities, and have come up with per capita valuations of damage. The American Enterprise Institute has done this. The White House Council of Economic Advisors has issued a report where they estimate the impact on the entire U.S. economy at $1 trillion, and they ascribe damages in certain amounts based on your state depending on state-by-state impact. So for purposes of preparing a pleading, we would not need a substantial amount of information from the county beyond what we have and beyond what I think we can get from public sources. To the extent we needed additional detail, I think with a few strategic conversations with key people in certain departments, we could get to the place where that I think would be appropriate for a sufficiently thoughtful pleading on your behalf.
I do appreciate the 2-page thing here. And I'm not trying to say that we're going to micromanage this.
Oh no.
And that wasn't my intent. And we're making a big decision on 2-page stuff. That's all I want to know is that that we will be in the loop on what these parameters are or what direction it goes. I mean, this may not be for you, but are we going to just get her report at the end and say, yay or nay? But are we going to get informed as to where we're going in incremental steps, or is this just going to be get a blanket report and look at it? That was my question. Because from here, it looks like you go and do all your work, and then we just look at everything, a final report. Is that what I'm reading here?
We certainly haven't had a discussion yet, as far as how we're going to manage the litigation once it does start, assuming it's filed. I think that is a discussion we probably do need to have at Finance and Rules, probably. I don't know.
It doesn't have to be solved right here.
Yeah.
I
think that is
just putting it out there.
Certainly something we should discuss as to whether it's managed by a small group, by the whole committee. I'm open to any thoughts anyone has. We can do it in a number of ways.
Right, and I think that the interesting thing was as far as the list of potential defendants and how we mold that to, what we perceive as who's been the major players that have caused, the potential harm based on your fact finding.
That's
so
right.
that's where it's the nuanced and specific to tailored to us.
Yeah, I think this would be a huge decision. Obviously, I can't imagine that Jefferson has served as a plaintiff in a large litigation very often. The AWP cases are probably one of a few examples. I think it's an enormous undertaking, and I respect that. And I think part of my obligation would be to help you achieve, to put a pleading together that makes the most sense for your county, for the ways in which this epidemic has affected this region, this area, your people, your services, your budget. That would be my goal, would be to prepare this in a way that works best for you all. And I'm very sensitive to the concerns that folks have about not being too broad, and the whole idea. The objective would be to put together a very solid, tailored lawsuit that reflects the impact of this epidemic on Jefferson County, and nothing more. There's no larger purpose here. It's just to address your issues and to seek relief that you all will find meaningful, meaning recovery for the expenses you've...
I just want to make one quick question myself concerning the retail opioid prescription rate here. And I did note in the very last note on the bottom paragraph there that it does say that the methadone dispensed through methadone maintenance treatment is not included within this data set. So that's what really reflects a greater concern why that has spiked. That's very interesting, very alarming in a lot of ways.
The IQ via exponent data is just a component of the total CDC data.
Okay.
So right.
Well,
not
more due
entirely-
diligence is
Right.
necessary then.
I agree.
But the question otherwise with this, is this, how does this look in another county that you've already been working with? Are we better, worse? Where do we stand compared to somebody else?
Well, I mean, if you compare Jefferson to the rest of New York State, Jefferson's not the worst, but it's not the best either. It's in the middle, but it's leaning towards one of the worst counties. It's not the most hard hit. In my other clients, their prescribing rates track state and national trends. And so I don't want to get too hung up on the spike. Like, I'm intrigued. I want to know the answer to the spike because it's a county particular. There's some explanation for this, right? So we want to understand what that is. But even without the spike, the fact that the trends increase as they do, even at the state and federal level, that's the opioid epidemic. We're looking at the epidemic. If this chart extended out to here, back to 2001, all these lines would be down closer to zero, right? The fact that this epidemic this chart reflects the extent to which it's taken root, and then we have this one-off thing with Jefferson, and I think we do understand why it is. But it doesn't, even without the spike, the prescribing rate is at a level that is improper given the consequences of these very dangerous drugs. So, but we can drill in on that.
Okay. Mr. Ferris?
Just real quick, and I'm sure everybody on the board probably feels the same way I do. And when I say that, I mean in the respect that nobody on this board wants to start litigation with anybody without evidence. I think that Mr. Giroux was trying to say very nicely, hey, without the smoking gun, if there's neglect, if there's a conspiracy behind it, that's different. If there's some fraud to the American people, to our people in Jefferson County, I don't think anybody on this board would oppose a litigation towards that. Some type of collusion, if you will.
Right. That's what this case is.
And I understand that. The point that I think Mr. Giroux was making, and I agree with him on this, is you said it's there, and we said we'd like to see it, and you can't give it to us. No, I understand. I'm simply making a statement. I'm not criticizing anybody, just so you know. But I would definitely be involved in this, and I'm opposed to this lawsuit right now. But I'm looking for the information that would change my mind. And the information that I think I'm looking for, I can't speak on everybody else, but is that purposeful? Let's get the American people. Let's make the money. Let's be unfair. All right. So everything you said sounded great, and that's wonderful. But I still oppose until I see the evidence. And like I said earlier, I believe our local doctors and I believe our local pharmacies are really good to our community. And I would disbelieve that they would be part of it. I don't know what a pill mill is. What is a pill mill?
Pill mills are establishments that are set up where doctors are writing scripts. Individuals can just come in and get a script written, and they can walk out the door very quickly. There's no actual service provided. There's no true exam. It's a place to go and get scripts for controlled substances.
Is that in New York State?
There have been pill mills throughout New York State that have popped up and have helped drive the opioid epidemic. There may or may not be pill mills here in Jefferson County. I don't know. But that's something that we would learn through the data discovery, is whether through the ARCOS data we would see if there were pill mills. There are pill mills that the data has revealed in Virginia and in Texas and throughout West Virginia and Kentucky. These are no, a pill mill is, that's right. That's right. That's correct. That's what it is. And so those type of establishments have developed to serve the opioid community. It's sort of like almost like a black market of sorts, and scripts originate from pill mills, and the ARCOS data that we collect from the DEA in the course of this litigation actually can direct us to establishments that are operating as pill mills. And then those can be named, those can be added then. So that's part of a process that's occurring throughout the country right now. You have litigants who filed, they've named manufacturers and distributors, then they collect their ARCOS data from the DEA. That allows them to drill into specific activity within their own region, and that data would reveal a pill mill. You know, like in one of the West Virginia counties, for example, there was one pill mill that was writing literally thousands of scripts. And this one establishment was driving, for this whole county, was driving the prescription rate. And I'm not saying that that's where the bump is here on this chart, but that's an example of something that could explain a bump. But I'm not saying that that is what explains this bump.
Thank you very much.
No, I think if you were curious to know a little bit more about pill mills, I think our district attorney would be a good one for you to contact, because I think she had been aware of one in the past. But the electronic scripts system that was put in place in this state was put in place to try to help address that particular situation. Because somebody would walk into a doctor's office, they'd take the whole pad, or they'd just walking in, just grab a script and go get it filled. As we've been told, you walk into a pharmacist, they are obligated to fill that. So that's, a problem. There's a breakdown within the system there. So, you're going to be very, very brief, Mr. McBride, because we do have a rest of agenda to...
Would this data include milk support drum, any prescriptions given on a military institution, federal hospital?
My understanding of this data is that it includes everything except what's in footnote A, or the methadone, but I can confirm that for you. Yes, I understand. The CDC represents that it's capturing everything except what it's disclaimed. So when I look at this data set, the only thing they've disclaimed is methadone from this one TVIA component. Everything else is supposed to be in here.
Mr. Doldo?
No, I just want to say thank you for coming. I totally agree with you. The manufacturers here, I feel, are at fault. I had surgery back in '93. I trusted my doctor. I don't believe my doctor knew the extent of these because of the pharmaceutical reps coming in and pushing their products. One big problem I always have had, and I thought was odd, is the amount of money that was spent at these doctors' offices entertaining them, and I think that just needs to be totally taken away from them, because there's a reason why they did it.
Yes.
A lot of parents in this community have suffered and lost thousands of dollars, and I've seen their kids die. I've seen parents go broke that were well-to-do to do whatever they could to save their kid. Mm-hmm. So for the unethical things that the manufacturer has been doing has caused an awful lot of death and problems in our community from, these people going in stores stealing to supply their habits. And you say the long range of them using them has no purpose, but what it does, I feel, is it makes them find things that are stronger.
That's right.
And just keep bumping it up, which costs more money. So I am 100% behind this. I appreciate what you do. Yours, like any other business, has a cost to doing their business, and what you charge and what I charge at my business is nobody's business. I have to make a profit. I have to take care of my employees. So I see where you're coming from. I don't feel you, as an attorney, you're also a mom, are out there to price gouge. I feel you're out there doing the right thing, and you're here for our community, and I appreciate that. Thank you.
Thank you, sir.
I'll say a little bit of a short notice, all the way from Texas. So
it's my pleasure to come and talk to you all. I enjoy that. I respect that this is a challenging decision. I do wish that I brought up copies of our pleadings to provide to you all. I want you to see the detail, because I think when you see the detail, you'll find it compelling. I'm confident of that, but it means nothing to me just standing here saying I did not appreciate where you all were in your own thought processes on these issues. So I thought we were farther along. I thought you were through the sort of the merits of the claims and onto the particulars of the damage and the impact. So I am sorry that but I think it's worth sharing those details with you, because this is not a frivolous undertaking on the part of myself and my team. This is the result of substantial research over many, many years, frankly, of focus on the behaviors of these entities. And Big Pharma does a lot of good. They do a lot of good. But occasionally they defraud the patent office and they report false prices. And here, a few companies, not the majority of Big Pharma, unlike an AWP where it was across the board, the behavior really was an industry-wide behavior. Here we really are talking about one brand manufacturer and then a few generic copycats who focus on a particular drug. And I don't begrudge them that they're seeking to make money, but they sought to make money by creating addicts and creating addiction. And then the consequences that flow from that are foreseeable and predictable. So this effort is an effort to hold them accountable for injury that they knew would come, and yet they conducted themselves as they did anyway. Yes. Yep.
Our attorney will be the conduit. So thank you very much. It was extremely informative, detailed to the best that you can offer to us, obviously. But I very much appreciate your communicating with us and helping us to understand this and to field questions.
Thank you.
So moving on, we'll have a lightning round of resolutions. Any corrections, deletions to last month's minutes? Seeing none, resolutions?
First resolution this evening is amending 2019 county budget relative to mental health programs and authorizing amended agreements in relation thereto.
Motion, Mr. Dodo, second. Mr. Ferris, discussion. All in favor? Aye. Opposed? That was an impressive aye.
Authorizing agreement with the New York State Department of Education, approved agencies for the provision of special education services for preschool children with disabilities.
Motion, Mr. Maxson, second. Mr. Dodo, discussion. All in favor? Aye. Carried.
Third resolution is authorizing agreements and establishing rates for the provision of related services in connection with program for preschool children with disabilities.
Motion, Mr. Nabuanic, second. Mr. Drake, discussion. All in favor? Aye. Opposed? Carried. There's a few departmental reports within your packet. Is there anything else to come before the committee this evening? Mr. Maxson?
Thank you, Mr. Peck. It's too bad that she left. I was going to tell her I appreciated her coming all the way up here. If the allegations that she's unsubstantiated but provided to us are true, I am more convinced than ever that these lawsuits brought by municipalities are a race to the bottom, an employment plan for the personal enrichment of attorneys, and that if they are true, the Attorney General of the state of New York will represent us. That this lawsuit represents very little more than a frivolous nuisance lawsuit. If they are crimes that have been committed, if there are crimes that are proved to be committed, then let the Attorney General represent us and let the people receive 100% of the settlement satisfaction rather than having an attorney skim 15% off the top.
Okay, any further discussion? I'll entertain a motion to adjourn. Mr. Maxson, second. Mr. Dodo.
Let's just take about 3 or 4 minutes to get up, stretch for a second, to get settled. We've got to put something on for a PowerPoint, so 5 minutes.
I'm glad you're there.
John, what a crappy night to phone you.
I was, yeah, just said, oh my goodness.
Yeah.
Good to see you. How are you? Yeah, you're looking well. I get
They're good. They're in trouble. One of the boys is in trouble. Call from the principal, almost every. Don't play on it.
yeah. Ready for round two here, I guess. I'm sorry that,
I'm gonna give you the same level of grilling.
I deserve it. I accept that. It's part of my challenge, but.
But I have the added benefit of having done this.
Oh, but.
Bodies are very.
Had mentioned the fact that there's any problems, you were on the board, so it's your fault.
It is. I accept that.
Do you want the one with the video or without?
I'm sorry.
The one with the video or without?
There is one video, and what happens?
You want it with the one with the video?
Yes. All right, I'm sorry. And when we go to this one, that's where a second video resides, or the video resides, rather, and just by punching on that.
Jefferson County wasn't my...
Famous last words.
No, it works fine. So you just click on it.
Jefferson County was... Jefferson County...
Right. So how do I scan through the,
Well,
slides?
if you want, we can do...
Whatever you think's easiest. Try to make this as quick as possible.
Well,
Click the back one.
Jefferson County...
if I go back, slide it all to 15.
Hopefully I won't screw it up. Just did the back one. All right, thank you. So I'm glad you're here. So how you doing there, young man? Yeah, well, we're reaching out to all three counties, and we've got pretty good support. So we'll get a sizable number of bands and additional clothes, cars, and that sort of thing. It should be a good thing. Well, you should know what super. Well, thank you very much. I really have enjoyed helping you. Right, yeah. It's a great group, and I really enjoy the interaction. I'd like to see them focus a little bit better on leadership. I feel like a lot of organizations, but it's really just been more kind of overview of what those programs entail, as opposed to different leadership aspects that make them successful in the challenges they have to overcome. So things like that, just being sort of provided that basis. Oh, I'm going to apply some leadership practices, make some mistakes. I didn't. We all did. One day, I mean, when you're out of your point, there's a 20-year-old, 30-year-old. Well, and the other problem is, I saw it when I was an instructor at Fort Worth. You get a and all these talking about I'm going to go to Korea, I'm going to travel to Thailand, I'm going to do all this stuff. It's like, oh, you know, you're, and they just don't understand. So I don't know what's in it for me and how do I know my kids. That's right. Well, the thing is, so I was nominated and went through my and then the treasurer. And it's like, oh, we need a treasurer. And I'm like, okay, I'll do it. I can build my career. I'm not a cool guy. And the treasurer, and I went through it was it's been a neat experience. Michael. He was really amazing. Yeah, so he's facing I started looking I did have this big hole. 41%.
So, yeah, I'm sorry. I believe everybody knows Don Alexander, but if you don't, he's here to give us a presentation from the Jefferson County Economic Development.
Well, thank you, Bill. I appreciate it very, very much. I'll make this brief because it's past my bedtime now. But seriously, I want to thank you so very much for allowing me an opportunity to come over here and talk about development in our county, because it's so very critical to what we do. And unlike some of the subjects you'll be talking about, economic development affects all of us. Every single one of us, every mother and father and child in our community are impacted by the decisions we make. And based on what I heard for the last 2 hours, you guys are involved in some pretty heady decisions these days. And so I fully respect and honor what you have to accommodate and deal with. And I want to apologize to Fritz right off the bat here, because if I put him to sleep, Fritz, I'll have to take responsibility for that. So you'll hear a good presentation once I do mine, and this will be brief, because I'm hoping that we'll do this on a more regular basis. I hope I have an opportunity to come back and talk with you about some of the concerns that I have and I think our agency has with respect to the future in New York State and how it's going to impact Jefferson County. I'm very concerned about things that are going on in Albany and how they're going to impact our ability to develop our community going forward. So I hope we'll have an opportunity to share some of those thoughts and get some of your ideas, and then perhaps take a more active role in deciding our fate, if you will. Let me first thank Bill Johnson for his leadership. Bill, as you well know, is your representative on the IDA board and has been just a sterling member now, having joined us for a few months. He had a full head of hair when he began, you may recall, but his actions have been great. We started this morning just before 8 o'clock in our first meeting, and we have several more lined up, and we're taking a lot of initiatives. I'm sure Bill will share and does share a lot of those going forward. And I want to thank Mr. Maxim because he too served as a representative on the IDA board. It got so bad that he had to quit his job and leave, so I apologize for that. And if there are any faults in the organization, of course, it's his, just to let you know. And also, I'm just kidding, Jeremy, you know that. And also want to thank your chairman, Scott Gray, who also spent some time with us and will actually come over and have a cup of coffee now and again, which is always appreciated. And that reminds me, this is something we'd like to say to you, that our doors at the IDA are always open. And I brought Dave Zembak with me, who is my deputy, but he serves as my bodyguard because every time I mention the IDA, there's at least 20 people ready to kill me. It is a role we play. It is misunderstood by virtually everyone, but we hope it's an effective role on behalf of the members of the county, all our citizens, and particularly you guys who serve in the elected office. And believe me, there is nobody on our staff of 7 who doesn't understand how important the role you play. And I'm not blowing smoke at you. This is a tough job, and it's going to get tougher as I look ahead to what's going on in Albany. So good luck with that. Just as background, IDAs were created back in 1969, so we've been around a while. Our agency is 46 years old, give or take. We have 7 full-time people. Frankly, they work their butts off. I think Bill can attest to that. We spend a lot of time doing our job. Unfortunately, or fortunately, I guess, a lot of what we do is not a matter of public record or public knowledge. We're working with small companies, small businesses. A lot of times they have issues they want to talk over, try to get some resolution, and frankly, it's not a public process. We have to be quiet about that if we are ever going to be helpful to them, and we certainly hope we are. We've got some classic examples of that we'll show you in a minute. There's 120 of us at the IDA levels across the state, just for background. We're a public benefit corporation. As you guys all know, you staff, our board, they're all volunteers, they're all good people, many business people. They work very, very hard at the famous things like pilots, which are about as well liked as outdoor commodes these days. We do lease backs, we do a number of different activities to try to increase economic activity within the county. So we'll go into details someday about that, but let me just share a couple things here and push the button. And one of the things we do is marketing on your behalf, and we thought we'd share just a little of our marketing activities by presenting one of the newest of our marketing television ads, and we're just going to hopefully make this work, and you can see what it looks like. Well, let's see. How do you like it so far?
Jefferson County wasn't my first home. I came here to serve, expecting the cold and not much else. But I discovered warmth in the people, the charm, and the beauty of this breathtaking place. And fortune found me a home that felt right for the very first time. It isn't just what you see on the surface either. The North Country at the foothills of the Adirondacks, bordered by the Great Lakes, the St. Lawrence River, and the Thousand Islands. Stunning scenery and stories of a historic past offer the backdrop, sure, but what sets us apart runs deeper. A spirited current that flows through a determined people. We are farmers and fishermen, citizens and soldiers, but also families and friends who believe in and support one another. We push ourselves not just to survive, but to thrive. And you can feel it the moment you arrive. Doors opening, opportunity brewing, and a fresher lifestyle at the center of it all. This is my home. This is my family. This is my future. Nestled in the heart of the North Country, but connected to the world. A place that you can spend time with the ones you love. Because in Jefferson County, New York, I couldn't be more excited for what comes next.
That's part of the marketing effort that we've designed to speak to others who may not or be familiar with our county. Obviously, it goes without saying, all of us who do this work are very proud of us. We're very proud of our community. We're very thoughtful about the future, and we hope by working together we can improve that a good deal. Let's see if we can get this thing to work next time around. Oh my goodness, I'm gonna require some additional help. Yeah. You would think after all the years in the broadcast business I would figure out how to push a button, but I haven't. Okay, well okay. All right, let's take a quick look at about how the agency people spend our time. It's just kind of an idea of some of the things that we do. As you can see, a fair amount is administration and reporting. We have more and more outreach on the part of state officials as we try to keep track of what we do. We do an awful lot of outreach and retention, not only for existing business, but also on behalf of business we hope to encourage to develop here in the county. We do a lot of marketing. And of course, one of the issues that is primary in our mind is workforce development, because if a developer, for example, is looking to come to our community, probably the first question they are going to ask is, what is the condition of the workforce? And so one of the things someday I would like to speak further to this board about is how we can improve development of the workforce. And there are several ideas afoot, several on the drawing board as we speak, but frankly, there is much more we can do, and frankly, much more we should do. Otherwise, we're going to see a further evacuation of some of our young people, and that would not be good. Just a quick look at some of the current activities. It was suggested by Bill we give you kind of a snapshot of those things. Right now, there are 24 current pilots underway. We add about $1 million every year to the local tax base based on those pilots. What you're looking at is the Clayton Harbor Hotel. We started working on that project with a visit from the owner of that hotel 6 years ago in Cooperstown. And this, tells you how long it takes to bring one of these projects to fruition. We like to think that that project would not have been built were it not for the impact of the IDA, working with all of the other Clayton LDCs and other important community organizations that we typically deal with. Recent expansions that have been supported by pilots, names you will know. There are 4 large employers totaling over 650 jobs. Great Lakes Cheese, Roth, current applications, and others are all extremely important. And then, of course, New York Air Brake. And by the way, I think you will be hearing more about that in the near future. We function often as a bank. We do microloans to companies in need of capital, and that's always one of the challenges when doing development in your community, is to find capital for them to expand. We do microloans. We now have 15 active loans totaling a little over $300,000 and a projected 35-plus job created with that lending. We have a larger fund called the Revolving Loan Fund. This is in the $240,000 to $250,000 loans. Activities are 14, a little over $2 million out on in the community, working as we speak. Oftentimes, we partner with other local development organizations like the Development Authority, Watertown Trust, ANCA, and others to expand our ability to provide some of this background capital. We do bond activities. The county was kind enough a few years ago to let us form the Jefferson County Civic Facility Bond Corporation, and that enables us to do bonds for our projects in the community. One of those, our most recent, was Samaritan Medical Center Cancer Treatment Center. We bonded for $95 million. The Civic Facility Bond Corporation, acts as a conduit lender. It does not obligate the county for these bonds, but it does allow us to present a very excellent rate of interest on these bonds. Were it not for our organization, it is, I don't want to overstate this, but it is quite likely we would end up with a lesser project because additional costs can be devoted to the capital expenditures rather than interest payments. So we work hard on this bond activity. Another one that we've recently completed was at the community college. We bonded for $22 million plus there, and that enabled the college to undertake its dorm project. We are in constant communication with two other potential borrowers of these funds. Whether or not they come forward, of course, we never know. It's the kind of work that goes on every day of the week, but we can't really talk about it until something actually happens. We have to administer these bonds. We have to maintain records of these bonds. We have to, if they need changing, these obligations have to be changed. We have one ongoing as we speak, and our board will be looking at this at our next board meeting. We do industrial revenue bonds. This comes through the IDA. The most recent was the re-energy project on Fort Drum, where they expanded to meet the needs of Fort Drum when they wanted to ensure that their supply of energy was locally generated and distributed. And it was a very important initiative on behalf of the community. Again, most of this is done quietly. You probably don't see much about it, but it remains a very critical aspect of what we do. We work on business expansion and relocation. This is one example, able to work with them on, thanks to Dave and his group, able to solve some border issues, worked very hard with them on finding a location that had some issues with respect to workforce. We helped them with that. And this is the kind of company that we can take. It's a very high-tech company we can take and begin to develop in our community. And we work hard trying to find these folks. We provide business and technical assistance. Dave Zembak is probably the best grant writer that I have ever run across, and I want to salute him for the very hard work. It's unheralded. A lot of damn, days, spent pushing pencils and doing whatever. But that's critical for helping our business grow. We do business-to-business matching. You'd be surprised how often we will take one business and introduce them to another. We just had an example of that in Carthage, which I can't share with you, but I know Dan is familiar with this, although I don't think he'll necessarily reference it now. A lot of regulatory assistance. We're running into more and more issues with small business being impacted by things that the New York State is for whatever reason, doing, and people are looking to us for help in trying to moderate, ameliorate whatever we can, those things. Reference referral, we do that a lot as well. People call us and say, what was your work or your experience with particular companies? $3 million in grant assistance, if that gives you any idea about the kind of effort that's going on behind the scenes here. 101 jobs created, 342 retained. These are some of the companies that we have worked with providing that assistance. I think you'll know the names quite well. And we continue, once we do this, we continue our long-standing relationship with these people. They are never out of our mind. They are never out of our visitation program. We're constantly in there trying to make sure that they are satisfied and happy with the conditions they find here in the county. Safety training programs, Dave has been able to find $83,000 in grant financing for this. We've had 147 training sessions and 2,321 people trained in our Tri-County region. What's the value in that? The value is that our local companies do not have to send their employees to Syracuse, Albany, Chicago for training. We bring the training programs here that enables more people to be trained at less expense to our local business. So it's a very, very important thing. And this, by the way, is going to increase in sensitivity and importance as the next few years come up. Because what is happening is the traditional jobs that we're experiencing in our county are changing dramatically. We expect about 40% of jobs which you now can pick up a newspaper and see want ads for or whatever. About 40% of those jobs are going to be different in the next 10 years. And so what we've got to do, like Wayne Gretzky used to say, we got to skate to where the puck is going to be. We cannot continue to educate doing the same thing we continue to do. It's not going to work as we relate to the future. And in that regard, we are constantly in contact with the college and BOCES and others to try to enhance their educational programs. Business seminars, we've done a number of these, 35 sessions since 2011. We've done them on import-export, which is important for us because of our relationship with Canada, of course, international trade. Agricultural luncheon series, we just finished one Friday. I know some of you attended. I hope you found it as effective as we did. Great speakers. Workforce development, talent recruiting, another issue we've got to work harder on. Technology and innovation, very important. Some of the things that you guys subsidize us to help with is Jefferson County's ag program, and Jay Mattson and the guys have done just a phenomenal job here. We just finished this brochure. I think it was finished last week, wasn't it? Something like that. So, we're working hard on upgrading our marketing materials and so on. You can see the comments there. We've had national speakers, including this last Friday, which was fantastic stuff. We're in the middle of a expansive microgrid development here in the county, and I want someday to come in and hopefully bother you for a little bit longer period to tell you about the importance of this particular device in terms of economic development, in terms of securing our current numbers of employers and so on. We're trying desperately to increase the quality of power generation, trying to add stable cost, which I think you're going to see at least all the prognosticators we have talked to. They're seeing higher energy costs coming very quickly. We need to improve the reliability. We've got some serious problems with some of our outlying material. Bill can speak a lot more effectively to this than I can, but it's issues that we've got to address, and we think we found a mechanism by which we are doing that. We've hired a company called Acadia. We've been doing work with them for 5 years now. We have at least 2, maybe 3 pieces of legislation in front of the Public Service Commission now, which will not only change development here in our county, but will change development across the state. And it's important legislation in order to enact the governor's REV program, which you're, I'm sure, familiar with by now. Workforce development, these are the activities that we've been involved in: Career Jam, GPS for Success. We serve on the Workforce Development Board, so we're there at the Institute with the college, Manufacturers Day, the BOCES programs, and so on. We're working, as you well know now, on the business complex at the Watertown International Airport. We've got nearly $1 million of our money, and when I say our money, I mean community money, invested in this complex. And we're making steady progress now. It's been a very long and difficult thing. We have $28,000 in grass seed, which we immediately plowed under out there. I mean, it's just these kinds of things, bats, you name it, we've had to overcome it. We are working on a project. I have to say, today we had a meeting this afternoon which may very well indicate some activity out there, and we can't wait. It's something we've been working so hard on. We brought in, largely thanks to Dave, $3.3 million in state and federal grants. We now have the designation of a Build Now site, and we're pretty excited about this. Also, we're working immediately on the Agribusiness Development Park. This will be an international park. It'll be located on Route 3 near the BOCES facility. We have as many as 3, and maybe 4, companies looking to locate in this new agribusiness development. You may remember we ran into some development issues at our corporate park when we talked about providing a meat processing plant there, and we certainly didn't want to offend any of our existing folks down there because they're all valuable employers as well. So we discovered that the only way for us to do value-added agriculture is to create an environment where somebody who does feed, who does milk production, who does meat processing, whatever, will be able to feel comfortable in going there and will not offend anybody who already is located there. So we met yesterday with folks talking about infrastructure development toward that project, and we're hopefully breaking ground in the spring. So we got some things going there, and we certainly hope that continues. That's a really high view, and it's short and quick, but I hope it does give you some sense of what it is that's going on over there. Again, a lot of what we do is quiet, and it's negotiating, and it's working with clients to try to impact their small business. And I will say lastly, I've been doing this a very long time. Some of you would suggest too long, I'm sure, but I will don't laugh about that, please. But I share with you my deep concerns about what is happening in New York State. They are slowly but surely strangling us in terms of economic development. If they keep pressing the way they are pressing, which is shifting costs from the state down to the local governments, which is increasing things like minimum wage and those kinds of things without understanding the impact on small business. They are shouldering all of these changes. And anybody in small business today who thinks that their future is brighter because of the actions being taken right now, I would suggest they may not be fully understanding and appreciating. We've got to concern ourselves with how we are going to appear when we compete against North Carolina or Texas or wherever else we have. And one last example of a cardiologist. I've been spending a lot of time with him lately. He invests money on a different level. And he said to me a couple of days ago, I just opened my 3rd franchise in North Carolina. And I said, why did you do that? Why don't you invest here? He said, I can't afford it. I can't afford it because North Carolina is still running minimum wage at the federal minimum wage level, not New York State. And so when just that one thing, workers' comp, Family Leave Act, I mean, the list gets pretty extensive. Mr. Doler would be able to recite many of those, I'm sure. That's an issue we're going to have to deal with. Otherwise, our business is going to be really, really tough to do. And that's not only attraction, that's retention. We don't want people to look at another community, and they're being asked by every community in the United States right now to come join them, from Texas to Florida. We just lost one to Florida. So, we've got to work on this, and the IDA can't do it. We have to do it with elected officials who command the attention of Albany. So, thank you so much. Can I answer any quick questions? Yes, sir.
Don, was the presentation in this, was this all designed in-house?
I'm sorry?
Was the booklet and the presentation, was that designed in-house at the IDA?
Yes. Want to thank Marshall Weir for that extensive work. We do a lot of our in-house stuff.
It's phenomenal. The quality is excellent.
Thank you. I will pass that to Marshall because he spends an awful lot of time. If there's any doubt, take a look at some of our website activities. Some of like our main website or Come Farm With Us or some of the other which are really the outreaches that our agency tries to do on behalf of everyone. So thank you for that. I appreciate that. Yes, sir.
Don, if it was Marshall, very well done. Definitely commend him on that. And to the respect that you have been doing this a long time, you have. We do not want you to go anywhere. Thank you.
Thank you all. You know, I'm really proud of this place, and I know you are because I work with a lot of you almost on a daily basis, and I know that's what drives you for sitting in this room, and I mean it when I tell you I understand how tough the job is that you're doing. This example today, you know, about how you deal with drug overdoses and that kind of stuff, that's heady stuff. I'm kind of glad you're doing it, and I'm not. So the door is always open at the IDA. Dave and I would be very glad to host you at any time. Come on over, sit and listen, talk. Sometimes we can talk about things in that forum that we can't talk about in a public forum, and we're happy to do that. So please come see us. Mr. Chairman, Mr. Bill, thank you, sir.
Thanks, Don. At this point, I think we'll move right along to the second presenter, who is Fritz Heel from Advocate Drum.
Now a seasoned veteran of 9 months?
10.
10 months.
10, yeah.
Very
So
good.
I was just going to say, you know, Don's a great mentor, first of all. He's been a wonderful person to meet as I've come into this role. I haven't been doing this job nearly as long as he's been doing his, so I'll do my best to follow a great act. The other thing I kind of wanted to start off with just by saying that I really appreciate the video that Don just showed us, and I think that the undercurrent of the community support and the welcoming attitude that the North Country has for new members of the community, particularly our soldiers and their families as they come into the community, is really unique. It's what we refer to at Advocate Drum as North Country Strong. You'll see that theme running throughout the community here in the next couple of months as we lead up to our Armed Forces Day Parade. And frankly, it's that unique aspect of this community that made the decision to come back here for a second tour an easy one for my family. And I'll get to that in just a few moments. But Mr. Chairman and members of the board, I certainly appreciate for the invitation to come and address you tonight and give you a short overview of an important organization in this community called Advocate Drum, formerly known as the Fort Drum Regional Liaison Organization, or FDRLO. My name is Fritz Kiel, and for the last 10 months, as I've said, I've had the privilege of serving as the executive director for this fine organization. I'll begin by first saying thank you to the members of the board for your stalwart support of Advocate Drum over the years. Your recent $25,000 contribution has enabled us to do our critical work that ensures that Fort Drum maintains its prominent position in the North Country and that the citizens of Jefferson County benefit from it for the years ahead. For nearly 35 years, Advocate Drum has enjoyed a strong bond with our Army and the North Country community. It truly is a unique organization. Advocate Drum exists to foster the relationship between Fort Drum and the North Country, to mediate where conflicting interests materialize, and to continually advocate at all levels for Fort Drum and the soldiers, civilians, and family members who serve there. This mission is especially important during base realignment and closure actions, and it requires constant engagement and activity to protect Fort Drum from future base closures and/or troop strength reductions. So just to give a short history of the organization, back in the fall of 1984, when Fort Drum was selected as the site of the Army's newest light infantry division, and the United States Army's 10th Mountain Division was reactivated here in 1985. That decision made it necessary to rapidly develop and implement plans to expand the infrastructure, build new housing in the surrounding communities, expand the available health care access, and grow the school districts that would educate the children of the family members that would shortly arrive. During that period, the cities of the counties to be directly impacted by the location of that division at Fort Drum organized to form what was called the Fort Drum Steering Council. The general purpose of that council was to be the first point of contact between the military and civilian communities, and also to serve as a platform for informed discussion to facilitate the rapid expansion requirements. That council was originally predisposed to disband when it was determined that its planning role was no longer necessary, and the sunset for the Fort Drum Steering Council was determined to be September of 1990. However, after the sunset of the Fort Drum Steering Council, both the civilian and the military communities in the Fort Drum area felt that a follow-on organization was necessary to keep the lines of communication open between them. Recognizing that various organizations and agencies on specific issues and programs, recognizing that various organizations and agencies both on base and off maintain an almost daily contact on specific issues and programs, a requirement emerged to constitute an organization that could transcend those issues and serve as a point of contact and mediator for those issues. So therefore, the Fort Drum Regional Liaison Organization was formed to foster that strong positive communication that enhances the interrelationships between the military and civilian residents of the Fort Drum region. The FDRLO, or now Advocate Drum as it's known, has been supporting the post and the 10th Mountain Division ever since. When the Army made the decision to grow the division and add the 3rd Brigade Combat Team here in 2004, Advocate Drum was instrumental in bringing developers to the table to again expand the available housing, ensure that essential services were in place to support the growth and soldiers and family members, and to steer opportunities throughout the North Country for business growth that would attract service members to the region and ensure a great quality of life. During multiple base realignment and closure actions, Advocate Drum has served as a voice for the greater North Country community and an advocate for Fort Drum to protect it from cuts that would be detrimental to the region. In 2005, Advocate Drum was essential in securing the funding to expand the railhead on post, which enhanced the military value of the installation. That state-funded upgrade increased the railhead's capacity from 145 to 245 rail cars, which allowed the base to increase its deployment capacity from being able to load 3 trains per week to 5. Now here, 14 years later, Advocate Drum continues to work with our elected officials to replace those same lines in order to meet new demands for increased throughput. Advocate Drum was also heavily involved in securing the $50 million in funding to build the I-71 connector, linking the main gate on post to Interstate 81 from Fort Drum's main gate. In 2013 and 2015, Fort Drum again faced uncertain times as the Army reduced its end strength, at one time threatening to potentially cut some 16,000 soldiers from Fort Drum and the North Country. Advocate Drum again came to the front lines of the battle and organized a day of presentations, a listening session, and a huge support rally at Jefferson Community College. The organization did not just focus on the negative economic effects of the cuts, but rather focused on what the community brings to the table in terms of its tremendous support for the soldiers of Fort Drum and the 10th Mountain Division, and what Fort Drum does in turn for the community. Unlike other installations, Fort Drum relies on our community hospitals and schools for health care and education services, and the community has equally benefited from the increase in available health services, expanded course offerings, and cultural diversity in our schools. We planned and choreographed a day that allowed us not to just tell the representatives from Washington, D.C., but to show them just how closely our community is integrated into one that can no longer be distinguished as separate. We took them out to Indian River School and showed them the expanded course offerings and other programs the local districts developed to support the needs of a more culturally diverse student population. We took them over to Samaritan Medical Center and showed them how our Army doctors and nurses and our civilian medical professionals work together to provide a standard of care to our service members and their families like no other. We showed them that our military and civilian communities are so interwoven that pulling any one string would unravel the entire area. The results of that effort are clear, as Fort Drum and the surrounding community are stronger than ever. Our efforts do not just benefit Fort Drum. They serve a much larger purpose for the entire North Country community. One recent example of this effort was our education survey that we launched this past fall. That survey was designed to identify what is going well in our schools and what needs to be improved. Identifying those areas now will allow us to mitigate them before another base realignment and closure action is scheduled and ensure that our children receive the best possible education. As I've traveled around to various conferences these past few months, I will tell you that community education will be the criteria that posts are judged on in the future. Another is our annual economic impact report, which incorporates both the direct and indirect impact Fort Drum has on the community. This past year in 2018, we saw an 18% increase over 2017 with a total regional economic impact of $1.9 billion and more than 25,000 jobs in the Tri-County region. $1.7 billion and nearly 24,000 of those jobs belong right here in Jefferson County. Finally, we serve to tell the story of the North Country and Fort Drum from the community perspective. This year, we get to tell that story on a national scale, as the North Country was selected as one of 5 communities across the United States as a great American defense community. We look forward to celebrating this remarkable recognition at our Armed Forces Day Parade on May 18th here in Watertown, and then sharing our story with America at the Association of Defense Communities National Summit in Washington, D.C. in June. So you might be asking yourself, why is this important? Why is Advocate Drum necessary? Advocate Drum is necessary, and all of this is important because of the simple fact that having an installation in our community and enjoying all of the benefits that we do because it is here is a privilege, not a right. We must never become complacent and believe for a moment that a base realignment and closure action would not happen here. Instead, we must be vigilant, constantly engaged with Fort Drum and our local, state, and federally elected officials to ensure that we are ready when the next round of troop cuts occurs. Advocate Drum has been that voice and subject matter expert with boots on the ground knowledge to arm decision makers with facts when they make those recommendations. We are planned, positioned, and proven, ready when needed to advocate for Fort Drum and the North Country community. As a 26-year veteran of the United States Army with 2 tours at Fort Drum and with the 10th Mountain Division, I can personally attest to the tremendous support that the North Country community has for the post and for its soldiers. During my 2 deployments with the division, once to Afghanistan and once to Iraq, the community rallied around my family and gave them all the support they needed while I was away. It is because of Advocate Drum and its work over the past 35 years that the relationship between Fort Drum and the surrounding community is so strong. When I decided to retire, it was an easy choice to remain here in the North Country, and I was fortunate to join this team of dedicated volunteers to continue to support the brave men and women of the 10th Mountain Division, Fort Drum, and this community that I call home. I thank you again for this opportunity to introduce you to Advocate Drum this evening. I hope that I've given you some perspective on how important this organization is to our community and to preserving Fort Drum, and I thank you for all that you do to Advocate Drum. At this time, if there are any questions, we'd be happy to answer.
Thank you. So you're getting $25,000 a year from us right now, right?
Yes.
What's your other funding sources?
So the majority of our funding has come historically through state-level grants, and then we also have a membership base and some dues from those members that pay those as well.
What's your total budget?
Total budget is it's roughly about $220,000 a year.
How much staff do you have?
2, myself and the administrative assistant.
Thanks.
Yes, sir.
Thank you, Mr.
Mr.
Chairman.
Ferris.
I just wanted to say thank you. It was a very good presentation. You're a very good example of the military coming into the civilian life. I was very impressed with your entire presentation and yourself.
Thank you, sir.
If there's no other questions, then thank you very much. Fritz?
Thank you, sir.
You ready?
All right.
At this time, I'd like to call the March 2019 Finance and Rules meeting to order. I don't believe there's anybody out there from the public that would like to address us. And is there any corrections or to the minutes? If not, we'll move ahead to resolutions.
First resolution this evening is authorizing the establishment of a petty cash fund for the county attorney's office.
Motion, please. Mr. Nabowanic, Mr. McBride. Discussion? If none, all in favor? Aye. Opposed? Carried.
Next is amending the 2019 county budget to reappropriate funding from the New York State Department of Labor for Employment and Training Department.
Is there a motion, please? Mr. Drake, Mr. Cantwell. Discussion? All in favor? Aye. Opposed? Nay? Carried.
Next, funding position in the Employment and Training Department.
Motion, please. Mr. Nabowanic, Mr. Drake. Discussion? All in favor? Aye. Opposed? Carried. Next.
The only other thing I have is just to note that for next month we'll have presentations from the Thompson Park Conservancy, the Urban Mission, and the Dairy Promotion. And I do think David has one update on a matter from last month. He just wants to bring everybody's attention. Oh, yeah. Way late. Sorry about that. General Services Committee, that's what we're talking about. Authorized agreement amending the 2019 county budget capital plan in relation to the fiscal year 18 New York State Inoperable Communications Target Grant.
Motion, please. Mr. McBride, Mr. Drake. Discussion? All in favor? Aye. Aye. Opposed? Carried.
Authorizing intermunicipal agreement with the City of Watertown regarding fiscal year 2018 Edward Byrne Memorial Justice Assistance Program and amending the 2019 county budget in relation thereto.
Motion, please. Mr. Cantwell. Mr. Drake. Discussion? All in favor? Aye. Aye. Opposed? Carried.
Authorizing agreement with additional allocation for the Governor's Traffic Safety Committee Stop DWI Crackdown Enforcement Grant and amending the 2019 county budget in relation thereto.
Motion, please. Mr. McBride. Mr. Drake. Discussion? All in favor? Aye. Opposed? Carried.
Authorizing the implementation and funding in the first instance 100% of the federal aid and state March Tele program aid eligible costs of a transportation federal aid project, appropriating funds therefore, and amending the 2019 county budget and capital plan.
Is the motion, please? Mr. Cantwell, Mr. Drake. Discussion? All in favor? Aye. Aye. Opposed? Carried.
Authorizing the implementation and funding in the first instance 100% of the federal aid and state Bridge New York program aid eligible costs of a transportation federal aid project, appropriating funds therefore, and amending the 2019 county budget and capital plan.
Motion, please. Mr. McBride. Mr. Cantwell. Discussion? All in favor? Aye. Aye. Opposed? Carried.
For Health and Human Services, amending the 2019 county budget relative to mental health programs and authorizing amended agreements in relation thereto.
Motion, please. Mr. Drake, Mr. McBride. Discussion? All in favor? Aye. Opposed? Carried. There are a couple of reports in the packet. And did you have anything else?
Yeah, just one more thing from David.
David, yeah.
Last month, we discussed my making an offer of employment to fill my vacant attorney position with the added benefit of 10 vacation days and 10 sick days. I was able to make that offer, and the applicant has accepted at this point. Ms. Carrie Fehrenbach will be joining the office at the end of April. So thank you for that opportunity to entice her to come here.
Is there any other business? Mr. Maxon?
Thank you, Mr. Johnson. I appreciate you recognizing me since I'm not a committee member. I just wanted, one more thing I wanted to say in praise of the work the IDA has done. Those guys look like geniuses because they put that airport business park right where the bridge is going. It's like they couldn't have planned this thing any better if they'd planned it. So just kudos to the IDA for having the forethought and the vision, and it's nice when our plans can actually come together, and they come together well. So just keep up the great work. That's all.
Thank you. Anybody else? I'd entertain a motion to adjourn. Mr. Cantwell, Mr. Neblonic, all in favor, aye?
Thank you, guys. Well done. Oh, thank you, sir. I appreciate it. Jimmy, take care of yourself, will you? Yeah, you take care. Don't forget your, thank you, sir. Coming back to that.